Hi, this is Dr. Randy Grill, the nursing home dentist, here today to do a video on probably one of the most important topics we can talk about, and that's oral care for long-term residents, nursing home residents. And for most of you staff members that are watching this, a lot of your facilities will be having you take a test afterwards. Okay, now don't panic. All of the questions, I think the first 13 questions will be true, false, and they will all be true. So for you that are used to cheating on tests, put on your palm 1 through 13 and put true T on each of those. You'll do just fine. I may have you think on the 14th question, I may not ask it, but the information is the important part, not your ability to take a test. You need to retain this information, and so that goes into the first question: why do we do it? It's because your patients, your clients, your residents will have a healthier, better end of life. You will affect them tremendously if you're able to get them to stop refusing oral care. And that's one of the things we'll be going over. In the same thing of why, have you ever gone camping and gone 3 or 4 days without brushing your teeth? Yes, it's yucky. In dental school, they did a study, and they had young, healthy dental students, male and female, not brush, and I think it was 6-8 weeks. Their interpersonal relationships suffered. Oh, imagine that. It was depressing not to be able to brush, different things like that, and that was on healthy people. Our residents, and there are many studies being written today on how oral care affects heart disease. It increases infection when it's not done, and this is every 24 hours because the bacteria harden after 24 hours and you can't get them off with a toothbrush, and the fuzz grows. And so if you get the fuzz off every 24 hours, they live a healthier, better life. In our age group, sometimes, and I believe this, lack of oral care because they refuse, or their inability, they're combative, resistive, they just flat say no, or they want to brush their own teeth, it triggers failure to thrive, depression, and other medical problems. So it's important that you know this and that they'll have a healthier life if you're able to finesse them into not refusing. Question number 2, why should you know how to do oral care really well? And the reason is so you can teach the family. Experience teaches that those that have family involvement, and yes, I know you're an aide, you're a CNA, you're sometimes intimidated by families, but it's best for your resident that they learn how to brush the way we're teaching. Even send them to YouTube, youtube.com/thenursinghomedentist, how simple, and have them watch and see the same reasons that you know, that I believe that their loved one will be better off if they're involved too, especially before dementia sets in, and they won't allow you if it's routine. If the family does it, the staff can do it, and it just makes life simpler. Question number 3, can your attitude, voice tone, the way you ask a question create a refusal? You betcha. You may have just gotten divorce papers in the mail. And my wife and I have those situations, and we usually tell each other SIU until after work. Suck it up. You know, that's what a professional does. He treats each person with the best of his ability. You may have just gotten bitten by the person you were brushing right before this patient. Question number 4, how do I ask so that they let me do it? Okay, we all know they can refuse, but the way you do it can either create refusals or get their help. You set everything up and you tell them just before you go in their mouth, and we'll be going over a video in modified bass brushing video on YouTube where you just get it all set up. You go in, you do your modified bass technique, brushing technique, and you go to them and say, it's time for your oral care now. Now, they can say no at that point, but if you say, do you want me to brush your teeth now? It's like saying, hey, would you like me to pull out some some chest hairs or some of your hairs, you might as well ask that question, because you're going to get no to that, and to a lot of time to can I brush your teeth. So set everything up, get ready, and say, please open. We're going to do oral care now. Don't say brush your teeth. That's demeaning to them. They should be able to do that. Say, we're going to do your oral care required now, or oral care that the family wants us to do, or you talk to the families. They're there while you're there. You assume the sale. You assume that this is going to happen, and you treat it like all the other routines. Don't ask, can I brush your teeth? Just say it's time to do your oral care now when you're ready to do it. Don't give them time to think about it. It's right for them. It's good for them. I don't know an administrator, a state regulator, a POA, a family member that doesn't want you to brush, that doesn't want you to even finesse it. Yes, they can say no, and they can refuse, but do it in such a way that minimizes their refusal. This is something that needs to be done. Number 5, not brushing accelerates disease and depression. Yes, there are more and more articles coming out about that in the medical journals and geriatric journals. The best time for you to brush, as a person that can do all their oral care and do it themselves, is at night before bed, because the mouth dries out at night, and the acid that this little fuzzy stuff, the plaque, secretes, dissolves the tooth, and that's called decay, and it dissolves the gum, which is called gum disease. So if you brush that stuff off before bed every night, you're better off, and you won't have the dental disease you do if you do it some other time. But when is the best time? The next question is the best time for you to brush one of your residents' teeth when the family's there. Without a doubt is the best time. Incorporate them, teach them, send them to youtube.com/thenursinghomedentist to hear this video. Get them involved, and you will have a different person, especially before dementia sets in. That's why we do that on the little kids before they're old enough to say no. So the best time to brush the resident's teeth, like I said, is when a family member's there, but there's an or when they'll let you. We're not a cookie cutter. Sometimes 10 o'clock is better than 6:30 when Vanna White's on. And they're not going to let you at 6:30 no matter what you do, because that show's on. So be flexible. Talk to your supervisor. Try to pick a time in the schedule where they will let you. That's why they do baths in the morning and not at 8 o'clock at night. But we do brushing at night. What kind of brushing should I do? We've already mentioned modified bass brushing. There'll be another video on that you can watch in detail. Question number 10. What kind of brushing will hurt them? The back and forth scrubbing that most people do. It hurts their gums. It'll make sure that they refuse, and so don't do that. Learn how to do the modified bass technique. What kind of bristle or brush? A soft bristle, small brush. Even a pedo or a kiddie's brush is best as we grow older. We can't open our jaws as much. There's lots of things, but it's got to be a soft bristle brush in the modified bass technique. Question 12, and you may have heard this question before. The very best time to brush is when a family member is there or they will let you. Design their schedule so you can do that. And 13, why brush when the family's there? We stated again, this is so important. We're including these questions twice. Family members, when involved, the patient is different and more cooperative. They know it's important. 14, if the resident says they'll do their own teeth, fine, you let them, but you just say it's time for oral care. I will be here to help you, and you wait till they brush. If they won't brush, they can refuse, but be involved. If you think it would benefit them with an electric toothbrush, and we'll have a video on that also, have the family spend $12 and get an electric toothbrush at Walmart or their drugstore. It will make a huge difference in their life. So the things for you to do right now is go watch that modified bass brushing and some of the others on care. And I wish you well, and if you have any questions when in the facilities, you're always welcome to ask. Thank you.